Hey there, my name is Carrie Ibettson. I'm a registered dental hygienist, I'm a proud Burst ambassador, and I'm also an oral health coach. And I get a lot of questions about oral health coaching and the difference between that and traditional dental hygiene. And I wanted to share 3 things that I find to be most important, both in dental hygiene for clinical care, but also ways that you can really help coach your patients into health, and why that tends to be something that really sparks joy with them and gets them on board for doing the things that you would hope that they would do, that sometimes they don't always do. Number 1. We have to believe that a disease-free lifestyle can exist. And that's because if we don't believe it ourselves, it makes it really hard for us to motivate our patients so that they can rise to a level of excellence. If we don't believe in a disease-free lifestyle that's attainable for people, we have a hard time really putting in the effort and understanding how to explain things in a way to a patient that gets them healthy versus just telling them what to do. I find that to be pretty challenging sometimes in the current model that we have in dentistry, because we're missing out on a lot of those offices that really have an excellent team in place and really work towards wellness. So if that's not something that you have in your experience, a great place to maybe look for a community like that would be one of the higher level study clubs that some dentists are in, like your Pankey or your Spear, your Dawson. Those type of communities, those dentists are looking towards excellence. So if you want to see what excellence is like, get in with those guys and maybe try and work in with them to see what it's like working as a team that works well in cohesiveness. Number 2 would be asking permissive questions. And a lot of times when I'm speaking, I'll hear people say, well, of course we have permission to engage in conversation with our patients. They're in our chair, that's what they're here for. On one hand, you're right, we do. But on the other hand, we don't know what that person went through that day, or if they're ready to learn, or if they're having a bad day. My personal permissive statement is, Mr. and Mrs. Jones, when I'm working with you today, if I notice something that looks like it's a home care related issue, is it something you'd like to know about? And then I have to pause and I have to wait, and I have to wait for them to say it. Number 3 would be, when we do our OHI, oftentimes when it's done, we do it in a position where we're at the end of the appointment. When a patient leans back and we start working really hard on them, they start thinking about all the other things that are going on in their life. So by the time they get sat back up, a lot of times they're in a rush, and we're trying to give them that information that we know that they need, but they're not really ready to hear. So move your OHI to the front and use it as a teaching tool. Use it before you do any polishing, before you do any scaling, before you do any irrigation. Do some disclosing, and then get a brush in their mouth and show them how to be effective, and then let them use their tongue to feel what you've done, and though chances are they're gonna go, wow, it feels like I've had a cleaning. And this is the great part, because that's when you can start telling them, look at the amazing things that you can do at home. Getting them a great power brush like the Burst brush is amazing. So I hope that's helpful for you. Number 1, we need to believe in a disease-free lifestyle. If we can do that, we can set the stage for our patients. Number 2, ask permissive questions. It'll lower their resistance barriers. And then number 3, do your OHI before you do anything else. Even if that means you're just doing a quadrant and then you're going through the rest of your procedure and you're doing your stuff afterwards. But get in their mouth before you do instrumentation for OHI, and I bet you'll notice a huge difference. Thank you so much for the last few minutes. I hope it's helpful for you, and I hope to see you soon.